how would you know even that you have that condition? Let's talk about it. Hello everybody and welcome to Irene Talks. My name is Irene and I'll be the one talking. Okay, if you are a new viewer, you are welcome. If you are a returning viewer, you're also welcome. Today we'll be looking at episode 1 of our infertility series, and yes, we will be having an infertility series where we talk about infertility, and I'll be letting you guys know some general information about infertility, how you can boost your fertility, and some things that you might be doing that can be, hindering your fertility. We'll also be looking at some causes of infertility in both males and females. So if you would like to know about all these, just keep watching our infertility series. So today, being episode 1, I would like you guys to know general information on infertility, as well as some female causes of infertility. Now, there are many causes of infertility, and as I earlier stated, there are both male causes and female causes, right? But today I want to talk about just some female causes, because we don't have all the time in the world, yeah? So let's get into this video. I think I've been talking about these things for so long now. So when I say infertility, I'm sure you guys know what I'm talking about already. The person is not able to conceive, right? However, it is important to know that this person must have been trying to conceive for the minimum of 1 year, and while trying to conceive, they must of course have been having unprotected regular amount of sex. Infertility is divided into 2 parts, right? And the reason I want you guys to know this is it's important to give your doctor the correct information, just to help narrow down the cause of infertility. The first type of infertility is called primary, and that is you've never been able to conceive in your life. And the second is called secondary, and that is you conceived in the past before, but you are now having failure to conceive. And it's important to know this, as I said earlier on, because if it's primary, the problem could be from birth. Maybe you have defects from birth and you didn't know. And if it is secondary, it will be something that you acquired with age or with time or whatever. So give your doctors the correct information, please. So for a woman to be able to conceive and eventually deliver, there are some necessary essential criteria that are involved. Okay, so the first is healthy sperm and the ability for the sperm to be deposited high inside the vagina or in the cervix of the woman. This is a male criteria. When I say healthy sperm, I say that because it's possible that the sperm might not be healthy. Now, the second criteria is proper condition inside the woman for the complete transformation of the sperm. Now, when the sperm needs to be transformed inside the woman and actually gain more movement inside the woman. So all the factors that are necessary inside the woman for the sperm to reach that goal needs to be present. The next condition is ovulation, and I'm saying ovulation and not menstruation. If the woman is not ovulating, that is a huge block right there. The next step is fallopian tubes. The fallopian tubes need to be clear, need to be free for the eggs to actually make it eventually to the womb. Then we need that the sperm actually fertilize the egg. So even if you have ovulation every month and you have a clear tube, fallopian tube, if there is no sperm that fertilizes the egg, there will be no pregnancy. The next step that is also very important is for if there is fertilization, that is, if the sperm finally meets the egg, for the embryo that is formed to be moved from the tubes into the womb. So for it not to stay in the tube, when it is moved into the womb has to accept it. All this has to do with so many hormones and things like that. The reason I said all these steps is so that you guys can know how important both the male part and the female part is. Any problem that goes on in any of these steps that I mentioned will cause infertility. So from the sperm up until the womb, if there's any problem in between or that goes on in any of these places, we would have infertility. So that's why I said there are many causes of infertility. Speaking of causes, just so that you guys know, 30 to 40% is caused by male factors. So male causes account for 30 to 40% of infertility. Female causes account for 40 to 50% of infertility. And then 10% is unknown. Another 10% is both male and female causes combined. So when you go to see the doctor, please don't say, oh, only the woman should go or only the man should go. Both should see the doctor, because it could be the woman, it could be a cause from the woman, it could be a cause from the man, it could be a combined cause of infertility, and both can be treated simultaneously at the same time. Moving on. As I said, I was going to look and talk about some female causes of infertility. If you guys remember when I said we have ovulation, we have fallopian tube, we have the womb, we have the cervix and the vagina area. I mean, I said all these things when I talked about getting pregnant in terms of the woman. But amongst all these things, the highest number of cases of infertility in women come from ovulation problems and tube problems. So today we're going to look into ovulation problems, and I'm going to talk to you guys about some common causes of ovulation disorders. So why do some women not have ovulation? What can cause you not to have ovulation or decreased number of ovulation? When you do not have ovulation, the condition is called anovulation. When you have decreased number of ovulation, the condition is called oligoovulation. Do we understand it now? So what can cause you to have those conditions? How would you know even that you have that condition? Let's talk about it. So what is ovulation? Ovulation is when a mature egg is released from the ovary and it is pushed to the fallopian tube to be fertilized. This is ovulation, and it ought to happen every month in a woman that is seeing her monthly period, seeing her monthly cycle. Now, a very popular sign, a very common sign to know that a woman is not ovulating is that she also is not menstruating, or she has reduced menstruation. The menstruation and ovulation tend to come together. However, it is possible to be menstruating and not having proper ovulation.
So what did I say so far? Ovulation is when a mature egg is released from the ovaries and pushed into the fallopian tube to be fertilized. However, menstruation is something else. I'm not going into the menstruation topic right now.
Ovulation depends heavily on the female hormones, and anything that will cause an imbalance in the female hormones will cause an ovulation problem. 80% of problems with ovulation is caused by polycystic ovary syndrome. And I'm not going to go into details about this disease, but if you would like to know about it, leave a comment in the comment section. However, I would like you guys to remember that one of the ways of recognizing this disease, one of its symptoms, are irregular menstruation, reduced amount of menstruation, or no menstruation at all. And in this condition, there is an increased amount of male hormones produced in the female, in the woman. So, as I said, if you would like to know more about this disease, leave a comment in the comment section and I'll make another video explaining this condition to you guys. Another cause of ovulation problem is obesity. And then we have hypo and or hyperthyroidism. The thyroid is a gland that is located in the neck, and when you have overactivity or underactivity of that gland, it can affect the regulation of the sex hormones in the woman's body. Another cause of ovulation problem is tumors. These tumors can be located any part of the body, in any part of the body. It can be located in the brain, it can be located in the ovary. It doesn't even have to be cancer necessarily, it can be non-cancerous. But the thing is that some of these tumors produce hormones that cause imbalance in the hormonal level in the woman and end up causing an ovulation or oligo-ovulation in the woman. And then we have eating disorders like anorexia or bulimia. These eating disorders can also cause ovulation problem. Then we have aggressive, excessive exercise. This can also cause ovulation problem in women. And then we have hypothalamus and pituitary disorders. These glands are located in the brain and they are responsible for regulation and production of some very important hormones. If these glands are affected in any way, you would have lack of ovulation in the woman. And then finally we have premature ovarian failure, POF, also known as early menopause, and that is menopause before the age of 40. It is very important that you keep track of your menstrual cycle. So you know when your last menstruation was, you know if your cycle is regular or irregular, you know the number of days that your cycle is for, the number of days you bleed for, and all of that. It is very, very important that you keep track of your menstrual cycle. In future, I would give us some tips on how we can know if we are ovulating or not. But very importantly is if you notice that you are no longer seeing your period, it is important that if you are no longer seeing your period, you go to see a doctor. Not every case of missed period is pregnancy, as we have found out. So if you notice that you are no longer seeing your period, please do not wait for up to 1 year before you go and you start complaining about it. If you have not seen your period for 3 months, even less, go and see your doctor, especially if you know that you're not sexually active or you've not been having unprotected sex and you have not seen your period. Go to see the doctor as soon as possible.
So that will be all for today. I hope this video was helpful to you. I hope you learned something new. If you liked it, please press the like button. Remember to subscribe and share this video with others so that they too can learn a thing or two. And stay tuned for the infertility series next week and the coming weeks. I'll be talking more on other causes of infertility and some things that you can actually do to prevent them, okay? So stay tuned and have a wonderful day, guys. Bye.